Now, oral health. How much do we know about oral health? Are we doing the right thing? And can we do any better? I'm delighted to have with me Zara McKibbin this morning. Zara, you're very welcome.
Thank you very much for having me.
Not at all. Thanks for coming in. And you are a dental hygienist.
Yes, that's right.
Now, tell me, you also are a recent award winner. You are, let me tell you, the right term is, you've been crowned the best dental care professional in Northern Ireland.
Yes, that's
That is
correct.
some title.
Yeah, it's fantastic.
You must be very excited.
Oh yeah, I'm
very
absolutely
proud.
over the moon. Yeah, very, very privileged.
What exactly does that mean?
Well, my category is part of the Irish Dentistry Award, so
Okay.
it's held once yearly, a very prestigious award ceremony in Mansion House in Dublin.
Right.
So they have different categories. There's best practice, best team, all those sorts of things. So my category was best dental care professional. So dental care professional means any professionals who work within dentistry who aren't dentists. So
Right.
dental nurses, dental therapists, orthodontic therapists, all those sorts of things. So we're all in the one category.
And we say it was in Dublin, so does that include this Republic?
Oh, yeah, it's North
Ireland
and South.
And North and South?
Yes,
Wow,
North and South.
so that is very prestigious then.
Yeah, it's
Well
great.
done, you. So you'd be highly in demand then from now on.
Yeah, hopefully.
So as a dental hygienist,
Yeah.
and I was doing a tiny bit of homework on this because I don't know an awful lot of things about teeth. And it says they have services. A is prevention, B is education, and C is therapeutic. That is your role.
Yeah.
What does that mean?
So a dental hygienist's main role within the dental practice is promoting preventative care. So teaching patients how they can look after the teeth, how they can keep their teeth for life. That's my
Right.
main aim. So where the dentists would treat problems and
Yes.
also give advice, a dental hygienist is there to reinforce that advice and just educate people.
Yeah, you mentioned keeping your teeth for life.
Yes.
How do you keep your teeth for life?
Okay, well, there's three main branches.
Yes.
The first thing is regular visits. So you want to visit your dentist at least twice a yearly and your hygienist twice a yearly, just to spot problems before they become greater.
Okay, so would a dentist not spot the problems? Why do you need to go to the hygienist as well as the dentist?
Yeah, well, the dentist's main role is to carry out the exam, to check the teeth over. What a hygienist does is to reinforce the preventative care. So where people think a scale and polish, you just go and get a scale and polish whenever
Yes.
your teeth are dirty. That's not true. A scale and polish is the main way of preventing dental diseases. So whenever you're having your teeth cleaned, you're having all the plaque and those hardened bits of tartar removed. And also the stains. People like to have the stains off.
Yes.
But it's all about removing those bad bugs and bacteria within the
Okay.
mouth. So that's why it's so important to have the teeth cleaned twice a year.
And you obviously educate
Oh yeah, yeah,
all
yeah.
about the teeth. So what is
Yeah.
the therapeutic end of it? What does that mean?
We'll say if a patient is having problems with sensitivity, we can apply
Okay.
different varnishes, what we call desensitizing varnishes, but what they do is just to coat the tooth to protect it against sensitivity, or a patient's having a lot of decay, we can put special varnishes on to help stop those spots decaying.
Okay, and it differs obviously from dentistry, as you said, because the dentist will work with the problem and you work with the
Preventing
the
Yeah.
problem. Right, okay.
Does it make sense?
It does make sense, yeah. When you talk about teeth, the first thing you do is run your tongue around your mouth. Where are one of my problems? So I know that people will get a lot of gum bleeding and gum
Yes.
disease and that. What
Yeah.
causes gum disease?
Well, actually, about 80% of the population have problems with their gums.
Yeah.
So the problems with the gums are exhibited in different ways. So what people often notice is gums bleeding.
Yeah.
The term I hate the most is whenever patients say to me, "Oh, whenever I brush my gums too hard, they bleed."
Well, yeah,
That's not true.
right.
If there's what we call inflammation of the gum, which is caused by plaque sitting along the gum, that will cause bleeding gums. So whenever there's bleeding from the gums, that's an initial sign there's disease around the gums.
Okay,
Yeah.
right. That doesn't
So-
sound very nice.
Well,
So you said that if you brush too hard, this idea of brushing too hard does not cause your gums
no,
to bleed.
definitely not. That's an old wives' tale. Yes,
Okay.
brushing too hard definitely does not cause bleeding gums.
And what about flossing? Can that cause bleeding?
It can cause bleeding if there's inflammation there. So if there's plaque there, you can have bleeding whenever you floss. So
Okay.
the most important thing, what we recommend, is to do your flossing twice a day.
Twice a day.
Yes, definitely, before brushing. So it removes the plaque in between your teeth. So as you're brushing, then the toothpaste can get into those spaces in between.
And there's so many people that obviously we don't do that. We don't
No.
floss. I mean,
Definitely
every day,
not.
a few times a week maybe, but to do it every
Northern
day.
Ireland has the highest decay rate in the UK.
That's right, especially in children as well,
Yeah,
isn't it?
exactly. So it's a frightening trend that we're really trying to get onto and try and get it under control.
And the highest rate in Northern Ireland for adults as well as children.
Yes, both.
Is that because we don't look after our teeth or because we eat too many sweets?
Yeah, sweets could be a big factor.
Yeah.
Yeah, that's the other thing I was going to talk about. So to try and keep the teeth for life, we want to have regular visits to our dentist twice yearly, hygiene visits twice yearly.
Right.
We want to be flossing twice a day before brushing, toothbrushing 2 to 3 times a day
Right.
for at least 3 minutes, giving them a really good thorough clean. And the last thing is diet. So making sure that we control our diet. It's not about, well, obviously we want to curb the amount of sugar we take, but it's actually the frequency we take of sugar. So say, I don't know, your favourite packet of sweets. What's your favourite packet of sweets?
It would be chocolate. I wouldn't be
Chocolate.
sweet.
Okay, well, we have a bar of dairy milk. I'm
Right.
allowed to say dairy milk. So it's divided into squares.
Yes.
So if we say took a square now, that would produce acid in our mouth for half an hour. So that means after taking a little tiny square, there's acid attack in our mouth for half an hour. So that means for 30 minutes after eating that, there could be decay in our mouth. And say the show finishes now soon.
Yeah.
So say in half an hour we took another square, you'd have a further acid attack for half an hour. So that means if you're continuously snacking throughout the day, you can have continuous acid attacks on the teeth, which then makes it a higher rate for having decay.
Of decay. Oh,
Yeah. Sorry, I'm depressed.
No, tell me, how does one become a dental hygienist?
Well, my route was probably a little bit alternative. I started to do dental nursing, which I loved, and
Yes.
I was very fortunate in that after my year of dental nurse training, I was accepted onto the dental hygiene course. In Northern Ireland, there's only 5 places per year to train as a dental hygienist, so the competition is very high. Yes. So I trained for 2 years then at the School of Dentistry in Belfast,
Right.
and then I was very fortunate to get a job here in Newry at Appletree Dental Care.
Right. And you work in Armagh as well? You travel up and down?
I travel up and down, yeah.
Okay.
But my main days are in Newry.
Your main days in Newry? And
Yeah.
you work 5 days a week, obviously?
Yeah, I work 5 days a week.
And you're going to be busier now?
I'm going to be busier now, yeah.
Why did you choose this career?
Why did I choose this career?
Why?
I don't know, I just always loved teeth, and I love the sector I'm in now, where not only I'm working in surgery, but I'm also going out to promote oral health as well as general health, because as many people will know now, there's a definite link between oral health and general health. So where people have heart disease and heart problems, there's a very strong link to oral health. The likes of diabetes, other health problems link very strongly to oral health. So a clean, healthy mouth helps to also control those conditions.
It's linked to diabetes?
Yes, very strong
How
link.
is it linked to diabetes?
Because they're thought if diabetes is uncontrolled, then also gum problems and gum disease are uncontrolled. So if you're trying to control gum disease, that can also help to control a diabetic condition as well.
Okay.
Yeah, people don't realise that.
No.
Definitely not. And the heart problems as well, we're seeing increasing numbers of heart problems. That very strongly links to oral health as well.
Goodness me.
Yeah, you
It's
don't realise.
frightening.
It is
No.
frightening, yeah. People don't realise. And the likes of babies who are premature, things like that, all those things all linked to oral health. Everything's very strongly linked.
Babies that are premature are linked to oral.
Low weight birth, yeah,
Really?
is linked to oral health as well. Yeah, people don't realise.
How?
Yeah.
How is a low weight baby linked to
They're just,
oral health?
it's just thought with the bacteria within the mouth that can link. They do lots of studies. They're continuously studying things, but those are the main links at the moment.
Well, I know now I would floss, but one particular area it would
Continuously bleeds.
not continuously, but now and again, and it would make me go, what's wrong? When you hear about bleeding gums, it's gum disease.
Yeah.
And I have visited the dentist, and she said she doesn't believe there is any.
Yeah.
So if there's no gum disease, why would my gum bleed when I floss?
Well, there could be a filling that's catching there, that's
maybe-
catching on the gum.
Could it be anything to do with being too
It could
rough?
be your technique. Yes, definitely. It could be your technique. There's lots of websites you can visit online. Our Appletree Facebook page actually has a video on flossing and a video on toothbrushing that anyone can watch. And Oral-B, those different types of websites all have videos that you can watch for a demonstration of how to carry out the correct flossing and
So-
toothbrushing technique.
Really, children need to be educated.
Oh, definitely. Yeah.
In
Definitely.
brushing, because kids just don't want to brush their teeth.
Yeah, that's a continuous problem. Yeah, I frequently would go out to do school visits and things like that. Actually, it's No Smoking Day on Wednesday, so
That's right.
Yes, we're gearing up
Well,
for No
hopefully
Smoking Day.
that
Yes.
shouldn't be affecting primary schools anyway.
Yeah, no, hopefully not in primary
secondary
schools. But yeah, it's definitely something we're gearing up for, is No Smoking Day, because as dental care professionals, we also have a role in that field to help people. There's lots of people who want to try to stop, so helping to encourage those people on how to stop and how they can stop.
Yeah, I saw of a young guy on the TV the other night. He's only young, 20s I'd say, and he had a false plate. He had 2 false front teeth at the front and a little plate behind it.
Yeah.
And it's horrendous.
Yeah. Adult smokers have the biggest tooth loss. Compared to a non-smoker, you have a much higher rate of tooth loss whenever you're a smoker.
Yeah, and there's
Which is
one
startling.
It is. There's one of those other programs on about, I can't remember what it's called. Is it the makeover shows?
Oh, yeah.
And or the doctor, Christian.
Yeah.
He's had people in, and they've just literally had black stumps.
Oh, yeah.
How can you live like that?
Yeah, we frequently see that, But again, it's people who aren't getting the right advice. We want to reach everyone with the right advice of fizzy drinks are a no-go. Water and milk are the safest things to drink for your teeth. And unfortunately, fizzy drinks are a big cause. Dilutables still aren't great.
Yeah.
It's water and milk, really.
Water and milk.
Even if it says no added sugar, they still aren't good, especially for kids, toddlers. Diluting is not a good option. Water and milk are the best options to go for.
Okay, listen, I think we're unfortunately running out of time. Would that be right, Andrew? We are running out of time. Listen, Zara, thank you so much for coming in and
Thank
talking
you
to
for
us.
having me. It was a pleasure.
Great. And congratulations once again on your award.
Thank you very much.
Thank you.